After years of working with pain and inflammation, I created these blends to support the nervous system naturally. So now we're going to head into some things you need to understand about using these oils, whether you're using them yourself or you're using them in, like I am as a massage therapist, and putting them on lots of different people coming through my practice, or even if you're using them at home for your family. When applying essential oils to others, it's important to remember that you too are exposed to their aromatic intensity. To minimize prolonged contact, I prefer applying them neat to the feet and then wiping my hands on a towel. Alternatively, you can target specific areas like the area of discomforts like shoulder pain. You can put them on their chest or back depending on the oil's intended purpose. And we actually have a page that shows you where to apply, the best places to apply towards the end of this program. So using a single blend in your carrier oil, use approximately 10 drops of essential oil per ounce of carrier oil, adjusting the amount as needed. Always allow your client to smell the blend beforehand to ensure that they enjoy the scent and their body is telling you it's correct. Be mindful that the adrenal formula can be quite potent. Prolonged exposure may lead to sensory sensitivity, such as tasting the oil in your mouth. So it's better off to either put them on their body and wash your hands off, or put them into a tiny bit of oil and use that oil up completely and not be immersed in it for an hour or 90 minutes like I am when I work with people. Just remember that the less you can actually put onto your body when you use these, the better off you're going to be. So this page actually shows you the best places to put the oils, in my opinion. They can go anywhere. They really can. You put them on the skin, they get absorbed. Different areas of skin absorb better than others, like the feet, but you can use them anywhere on the body. Just don't get them into your eyes, your nose, or your mouth. And stay away from anything that's going to create a burning with the settle oil. So when it comes to acute inflammation and autoimmune, I love to use this oil wherever people have pain, around the surgical site, on top of the pain, and you can stack them together. And it doesn't matter the order. You can just place them directly on areas of muscle, tendon, or joint discomfort. And again, new surgical sites can have oils placed close to the wound, but not directly on the wound itself, and less is always best. So when we go into decompress and adrenal fatigue, I really like to put these where we're going to talk to our soul or our heart, and we're also going to attack that sympathetic nervous system, and then where they get absorbed the fastest, and then also on top of the adrenal glands. So you can use decompress on the heart chakra and on the sympathetic nervous system on the back and the feet. Those are the best places. And then adrenal fatigue is right across the adrenals, the kidney line, and then again on the feet. And when we talk about stability, lift, and settle, I like to use these again on the heart chakra. Sometimes I like to put them on the back of the neck because it seems to calm some things going on inside the body. It goes right into that nervous system reaction. The feet are fantastic for these oils. And there's one other area that I like to put them on, and it's your crown chakra. And the crown chakra is your communication to your soul. And so if you are having a lot of soul-related issues, then placing these drops right on top of your head on that crown chakra are very effective. And with small children, I like to use that crown chakra a lot because it is such a helpful spot energetically for them.